Okay, I think we're ready to begin now. Good afternoon. Welcome to Family Forum 3, Quality of Life Targeted Topic, subject of the Military Health System. My name is Ginger Perkins, and I'm honored to be one of your AUSA Senior Fellows. We would like to open today's forum by thanking our wonderful sponsor and relatively new AUSA national partner, National University. Please join us in thanking our sponsor for today's forum. National University, would you please stand up and be recognized? Thank you, National University. If you were able to join us yesterday for Family Forum 1 and this morning for Family Forum 2, we learned about how the Army is transforming prevention and the important role resiliency and readiness plays into that system. This afternoon, we're going to focus on another important component of quality of life and prevention, access to quality health care. This panel will focus on the military health system and how it adapted and modernized over the last couple of years. To be part of this conversation for the forum today, for those of you in the room, we have question cards. Please write down your questions and wave the card high in the air. One of our staff will get it from you. For those of you online, please ask questions on the Facebook feed. At this time, I would like to introduce the United States Surgeon General and Commanding General of the United States Army Medical Command, Lieutenant General Raymond Dingle, to give our forum introduction. Welcome, General Dingle.
Please give Miss Ginger Perkins a round of applause. I first want to thank AUSA and also Holly Daly. Holly, raise your hand. Everybody look over at Holly Daly. Let's give Holly. Holly is one of our champions. But I want to thank AUSA and Holly, as well as Ginger, for setting these forums up where we can come together and address our family forum needs. I also want to thank each of you all, the soldiers, the civilians, and the family members, for your faithful attendance at these. You all have been ambassadors, you have been advocates, you have been apologists for our families. So for the impact that you've made, the impact that you're going to make is tremendous. Our 38th Chief of Staff of the Army, the late General Odierno, was infamous for these words. Listen to this. The strength of our nation is its army. The strength of the army is its soldier. The strength of the soldier is the what? I'll say it like you mean it. That was weak. The strength of the soldier is the what? That was a little better, but I think we could do a little more. The strength of the soldier is the family readiness starts at the top and it permeates down through every soldier and family and civilian. Our Army senior leaders are committed to the readiness of our families, to the readiness of our soldiers. For those who can remember, it was just about, 7 years ago, if anybody can remember, our family forums. 7 years ago, our family forums were just a little spicy as we would come together because there were many unanswered issues and challenges that our families were going through. And I submit to you that over the past 7 years that the Army senior leadership has built a synergistic team between AUSA, between you, our families, our soldiers, and those who are supporting our Army families. And today we have a superb lineup, as Ginger mentioned, a panel of some of our greatest, best, and brightest leaders that are working, that are fixing, and that are also answering the call to the many challenges that our family family space, excuse me. Our first topic, as mentioned, is support of the military health system. And I have the distinct honor of introducing our distinguished moderator, Dr. Major General Retired Brian Lyon. Dr. Lyon is the Assistant Director of Healthcare Administration for the Defense Health Agency. Dr. Lyon has over 30 years of service in the United States Army Medical Department as a physician and as a leader, retiring as a Major General and the Chief of the United States Army Medical Corps. So, ladies and gentlemen, please join me in a warm round of applause for our moderator, the Dr. Major General Retired Brian Lyon.
What a great day. What a great forum. I've been to coming to these for a long, long time. This is where we solve a lot of issues. This is where we hear your issues that you're dealing with as soldiers, as family members. And so I'm not going to take any time because I know you're going to have a lot of questions, and I'd rather you ask the questions of the panel than hear me talk. So without further ado, let me introduce the panel. First, Lieutenant General Crossland, the Director of the Defense Health Agency. Brigadier General Mary Krieger, and Ms. Jessica Slaughter from Exceptional Family Member Program. So here's your panel. I'll turn it over to them to introduce themselves, and then we'll get into the questions. Ma'am.
So good afternoon, I'm Talita Crossland. I'm the Director of Defense Health Agency, been in place for about 8 months, having served as the Deputy Surgeon General prior to moving over to the DHA. Excited to be here with all of you today. As General Dingle said, this is a great forum where we get honest feedback and get opportunities to improve and do better, and also a forum where we can share with you all where we're headed. So look forward to an engaging afternoon.
Thanks, ma'am. Good afternoon. I'm Mary Krieger. I am a family physician, been in the Army for 28 years, although I'm not sure how it's been that long. But both a leader in the system as currently the Chief of the Medical Corps, and also a customer in the system as my husband Joe and I have 5 children who benefit from military health care. Had the opportunity to serve at the operational level, which people often think of the readiness moniker, as well as most recently commanding in the East, all of the Army Medicine Assigned Forces that are probably many of them seeing you in our military health system facilities. So I look forward to hearing what your concerns are and how we can best support global readiness, whether at the soldier or the family level.
Good afternoon, everyone. I'm Jessica Slaughter. I'm part of the G9 EF&P branch, newly arrived in February. I am a retired airman. I know that there is one Air Force member here in the audience, so I served 24 and a half years as a non-commissioned officer, and I started my civilian career in 2016. I am excited to be here. I am excited to hear the feedback that we're going to receive, the questions that you may have. This is so close to my heart, and let me tell you why. When I was on active duty, I had an opportunity to be the guardian for, and sorry if I'm a little quivery, but had the opportunity to be the guardian for my niece, who was born with a disability. And during that time, my sister was still in the picture. But what made us make the decision for me to become my niece's guardian was the military health system. Hands down, what the military was offering me and my niece was not comparable to what the civilian had to offer. And so taking that opportunity also came with some obligations, and there were times when I had to make a decision on whether or not I was going to relocate. And so when I am sitting here now and having the opportunity to talk with you guys and hear your concerns about the exceptional family member program, I am so excited to be here because I was there. And so I appreciate it, and I look forward to the discussion.
So, Corey, we'll start off with you then. I apologize. Jessica, we'll start off with you.
Yes.
My first question is, why is EFMP so important, and why is it important that we tell family members to enroll their children or their spouses or their parents in the EFMP program, because it blocks them from where they can move, and there's barriers to all the rest of that stuff?
A myth. So EFMP does not block anyone from moving. So I know Dr. Lyon is just saying that in jest, but what EFMP does is it allows that closer look. So when your family member has been identified, when your family member is enrolled, and it's time for the soldier to have an assignment, that closer look becomes important, because just as General Dingle has stated, that family is the bedrock for the soldiers. That family gives that soldier that extra oomph to keep moving, right? So we have to get it right. EFMP is a mandatory program. It talks about, we make sure that there's assignment coordination. We make sure that, folks have been identified, that they're enrolled. And then we also offer family support access. And so that becomes particularly important when a soldier has an assignment, and especially overseas. So we got to get it right. Why is it so important? We want to make sure that the family needs can be met when they are where they are moving to. So currently they need to be met, and when they're relocating, they need to be met. And so that becomes the reason why it's so important. Without that, we may lose the soldier, and we definitely can't take care of the family.
Thanks, Jessica. So, General Crossland, we have a great benefit and entitlement, but it's in the direct care system, it's in the hospitals, it's in the purchase care system, in the managed care support contract. We have a TRICARE dental plan, we have a TRICARE pharmacy plan. How do you envision, in your role as DHA, how are we going to integrate those seemingly disparate systems?
Yeah, thanks for that question, Brian. You and I worked together on this very issue. When I became the director, I acknowledged that healthcare and how you engage it is extraordinarily confusing. It can be, particularly if you're not in the direct system. And so first, I meet with and work with the managed care support contractors pretty regularly. As the agency, when we look at how to make things better, we don't just look at how we make things better in the direct system. We have to make sure that we look across the totality of the system. And that means we have to put processes, procedures, and resources to help navigate that space, to help us as the agency be able to see when you're out in the network, are you getting the care you're supposed to be getting, and are we able to get the information back? And then most importantly, working with the managed care support contractor to actually see our direct system as part of the network, right? Seeing that sometimes sending you to a civilian location isn't the right answer. It's actually to send you to one of our treatment facilities. And right now, we don't do that very well. And so putting a lot of resources against making sure that for you, it's just transparent. You need access, and then it's our job, working with the managed care support contractor, not your job, to be able to get in and be seen. And through the contract, we're working on smoothing some of that out.
Great, thanks. So General Krieger, you just left command of a great organization.
Yes, sir.
And you had to work with the MTF, the Defense Health Agency, and the senior commanders on all those installations about how you manage the healthcare delivery and then the readiness requirements that are required for everybody that's in uniform today. How did you manage that in your role as the commanding general?
Well, somewhat similar to General Crossland's offer, I called my friend Brian. But it really was that. So, and I think it's a great opportunity to clarify. People have asked, gosh, with the transformation, you're all in the military health system. What does Army medicine do? What does the Defense Health Agency do? And it really does come down to that partnership. For me, the end state, the measurement of my success is that there are soldiers that are ready to go out the door because we've addressed their medical needs, whether it's in the direct care system or with partners in the purchase care system. It also means that for the medical professionals who will support us as the Army, whether they're here stateside working in the military health system facilities or whether they're deployed downrange, they have all the skills, they've got all the training, and they are ready to go. And then there's also the readiness of the installations. So our hospital commanders are the directors of health services. So this showed in spades during COVID. Also when there's issues, even food inspections on our installations are all overseen by our veterinary services, which fall under Army medicine. So that's a huge readiness mission. So really it comes down to ready soldiers, whether those are medical soldiers or soldiers that are in other branches, installations, and then of course the families, making sure the families are getting the care they need so that the soldiers can focus on their mission downrange.
Great. So Jessica, the National Defense Authorization Act of 2021 said that we got to standardize EFMP, centralize it, and make sure that we're offering the same services that we're supposed to be offering at every one of the installations that we can. How far along is the Army in that journey, and where do you see the Army going in the next 2 to 3 years to meet the requirements of NDAA 2021?
Great question. Thank you. So our goal is to, have the central office established by the end of the year, and we're working very hard towards that. What the central office is going to do is it's actually really going to formalize our partnership that we already have with OTSG, with MCOM, AMC, with HRC, and with all of our stakeholders that make EFMP and make us do what we need to do for the families, right? And so we're hoping that is going to be established by the end of this year. But it's also that conversation will now be a collective voice. So all of our stakeholders are doing everything that they can for the families. They are leading the charge to do what they need to do for the families, but it's also bringing them into a space where we can share those ideas, where everyone has a voice at the table, and then we can start moving out the EFMP the way that it should be moved out as one single voice, right? And then, the best part about it, I think, is that, sometimes when you go into, the installations and the installations are stuck, all they know is that your package is here. They don't know how to reach out. They can't reach out. We will also be that bedrock for them. So when someone is standing on top of their desk and they're like, where's my package? I need my orders. Well, they can then contact us, and then we can move along and figure out, what is going on. So it's going to be that voice where we're bringing all of the agencies together, but it's also going to be an opportunity where we are receiving feedback at the installation level from the folks that are boots on ground, so that they do not feel so alone when they are being impacted by the families.
That's great. So tying into that, General Crossan, many of us face the challenges of when you get a consult and they say, go to the TRICARE network. You have to scroll through a bunch of names. I don't take TRICARE anymore, or I'm closed to enrollment in TRICARE, or the number goes to a dead-end box. The network adequacy, regardless of whether you're here in the National Capital Region or at Fort Irwin, California, this is a significant challenge. Can you talk a little bit about where it is and what you're doing with the managed care support contractors and what the next generation of TRICARE contracts is going to help us with?
Yeah, thanks for that question, Brian, and certainly acknowledge, I had the staff, I got a lot of feedback that the network directories are terribly inadequate, and I actually did a little pilot to try to quantify, because you get a lot of anecdotes, and I had 10 of my team, 10 members, call in the NCR to get a behavioral health appointment. And 10 people called 10 numbers, and 3 of them resulted in an appointment. And that's dreadful. And I didn't tell you how long it was till that appointment. We got the wrong measure in the contract, in all fairness. The contractor's doing exactly what we asked them to do, which is sign people up. And they do that in good faith. So the next T5 contract actually you have to check monthly the adequacy in each of the areas, and there are penalties for not having a network that actually has capacity that actually leads to appointments to see individuals. And so T5 is supposed to kick off in 2025. I hopefully don't get fired for saying that. There's a protest that's finishing up, but we anticipate that it'll roll out in 2025 and address that. But that's not to say that we're not addressing it with both managed care support contractors and overseas today on the network adequacy, and they're getting after it, doing a bit better on making sure our patients get in and get seen.
Great, thanks. General Krieger, you talked a little about the responsibility of the MTF commander, and a lot more than just running the MTF, but they're the installation health service subject matter expert for that senior commander on the installation. Can you talk a little bit about how you enabled that and how you standardized that across the myriad of platforms that you commanded?
Yeah, absolutely. So our senior mission commanders are key in helping us understand what they need from Army medicine. And so the nice thing about our commanders also being the directors of the MTFs is not only do they get the demand signal from the senior mission commander, the leadership on that installation, but they also have the resources that they're able to answer that with. And whether that's locally or even in a broader sense. The other big thing that happens in our MTFs, and you may be aware of this, is the graduate medical education piece. And so they can integrate to ensure that those soldiers who are being educated to serve for today's graduate medical education is tomorrow's readiness. We generate our own force, which is huge because you may have heard there's a shortage of healthcare workers in America, and Army medicine is contributing in our own way with the Defense Health Agency, Air Force, and Navy to close that gap. So the importance of them being engaged there, and then also as the director, is that they can provide that venue where they're getting top quality education. And then they also ensure that they get their Army skills as well. My sergeant major's in the Army, and she would take me down if I didn't say that we make sure all of our medical providers can shoot, move, communicate, and medicate. So they bring that together to ensure that those who are serving in the MTFs are also ready to serve overseas, are also ready to make sure that our installations have what they need from a medical support perspective.
Great, thanks. Hey, we'll get to a couple of questions from the audience, so keep bringing them up. Thank you very much. And this is both to Jessica and to General Crossland. So EFMP nurse case managers are an invaluable component of families being able to navigate the complex EFMP health system. Is there a plan to increase the number of nurse case managers at our military treatment facilities?
Great question. So
I'm going to let her go because she said, yes, I know she's got the money.
So I will say that we are always looking at opportunities, but let me just say this. We don't have the money, but we are always looking at opportunities to increase our staff so that we can continue to get after the needs of the family members. It's so important that we have those nurse case managers who are helping our staff members navigate, who's helping our family members navigate those processes. And so maybe General Crossland, who has the money, will be able to tell us, will we be plussing up?
Yeah, very fair. So to answer your question, we're looking at nurse case management for a lot of things in our system. And as I said earlier, the requirement in healthcare to care coordinate, so we got to get the right terms. I think that in EFMP, there are several opportunities to do better. One, we're all getting after, which is the handoff. Simply when you go from one installation to another installation, how do we make sure that if you have or need a referral, that referral is put in, that you get a warm handoff, and that we are working as a team to get that done. And then there's some medical conditions within EFMP that should be care coordinated. And I approach those like I would every other care coordination. And we have some, and can we use more? Yep, in the area of behavioral health. And so we will look hard that it may not just be a body, it may be a system that helps us do that. But yeah, I acknowledge that in some cases, if you have a child or a dependent with complex medical needs, care coordination is the best way to manage their health care. And again, discriminating that from navigation and moving folks over, which I think we're actually getting better at.
Right.
So this ties a little bit into that. And this deals more with our more remote sites. So the Fort Leonard Woods, the Fort Irwins, the Cannon Air Force bases. Rural military families have a great challenge with locating and getting care providers, especially those that provide services for EFMP families. How are we preparing or prepared to assist these families? And what do you say for those that are struggling to get adequate care in some of these small and more remote installations?
I'll grab that first if you're okay.
Absolutely.
First, full transparency, there's a finite amount of capacity in any healthcare system. So there's a shortages of pediatric behavioral health in the United States. It doesn't matter where you are in the United States, it is going to take months to get into a pediatric, all right? So I don't want to say that I'm going to solve that, but what can we do better? I think one thing we are definitely doing better, and the pandemic taught us, is we were defining for everyone that to have access, that means you have to have a face-to-face appointment. And what the pandemic showed us is that we have the opportunity to scale some of our finite resources through virtual. And we're targeting virtual as an example for really difficult things to deliver in remote areas where, for instance, behavioral health is really difficult. So Telebrave is a contract that we have out that is looking at behavioral health for family members, and we'll start to bring in some active duties. And the contract is within the DHA. They're providers that are our providers, but they're pointed at some of our more remote locations so that they may actually be located in San Antonio where we could hire, but they're actually providing care in some of those remote locations. Some of the other things we're doing is we'll do what we call the, I don't want to call it round rover, but we send traveling clinicians, all right? So if you, in this location, you need this much care, and it's not enough care to be able to hire to, can we move a provider, say from a large med center, to visit once a month, a visiting provider once a month to provide that care as well. And so we're looking at leveraging all the capacity we have, and at scale, use technology, use, and actually from other services too. And I think that's one of the advantages of the agency. So we may have some Air Force teammates actually visiting an Army installation to provide a capacity that is needed at that Army installation, and the reverse is true as well.
Circuit riders.
And if I can just pull on that a little bit, that is why identification and enrollment is so important. Because we cannot send a family, should not send a family, will not send a family to a location where their needs cannot be met. And so, you know, as we listen to General Crossland and all the great things that are going, you know, that are going to be happening, that are happening, we fall back as EFMP because we understand the importance of making sure that families can be taken care of at the location of where they're going and where they are currently serving. And so working very closely with OTSG and MedCom and making sure that when those assignments, when soldiers are being considered for an assignment, that we look very closely at the access to care and making sure that the needs are being met.
Great, thanks. General Crossland, General Krieger, we hear about this all the time. We still haven't figured this out. How do we hold beneficiaries accountable for missed appointments?
Oh, my.
Yeah, I'm not trying to hold beneficiaries accountable for misappointments. I'll say that out loud. What I think, what we're definitely trying to do in the agency is when you miss an appointment, and I won't ask a very senior leader who told me they missed an appointment, when you miss an appointment, it's because life happened most times. And what I'd like to, what the agency's actually working on doing is broadening our definition of access in such that it decreases why you miss an appointment. If you can do a virtual, if you can do an asynchronous, meaning you can send what your healthcare issues are, and then we give you feedback through your electronic record, or we can do a virtual, we could do a telecon. So give you more options, acknowledging that how you engage us actually matters. It's not a one-way street where you didn't come through the door at this time, and therefore. And so I'm not really putting a lot of energy into holding beneficiaries accountable on when they miss appointments. I am trying to focus on, as a system, how can we leverage that capacity? So after 5 minutes, if you're a no-show, can that clinician open up to a virtual appointment and knock out somebody in the queue waiting to be seen? And then as a system, we still end up being effective, right?
Yeah, I think ways that we can help proactively as we work with senior mission commanders. There are sometimes an MTF commander will find, gosh, this time of day for units is not good, so we can preferentially have appointments that may be more in, aligned with their PT schedules, what have you. In the past, we've helped with appointment awareness, of course, while protecting HIPAA. But this is where our healthcare system is a little different in that we work to support soldier and family readiness. We're not that business. So we maybe look a little different, but it really comes all down to supporting the soldiers and the families.
Thanks. General Crossan, these next two questions are kind of combined, so I'll take the liberty of combining two questions, but it deals mainly with the retiree and the TRICARE for Life population, about how oftentimes they are marginalized or they're not allowed to be enrolled into the military treatment facility, or it's even harder for them to get access and to get into the military treatment facilities. What are we doing in the DHA, and what are the MTFs doing about trying to attract more of the TRICARE for Life and the older population back into our military treatment facilities?
Yeah, Brian, thank you. Back to the my original conversation about running an integrated system. As the director, we're accountable for the all 9.6 million. And most of that 9.6 million actually are retirees and their family members. And so I care deeply about that promise to deliver care anytime, anywhere, always applies to them as well. And we've had incentives in the direct system where enrolling, we had incentives where enrolling retirees wasn't advantageous. And so we're blowing that up. Not all at night, not all at once, right? We've got to re-wicker, as you know, we're re-wickering how we deliver care, particularly since if you're in the network, you're experiencing what most of America has experienced, shortages of health care. And so we had TRICARE rules that made it hard to actually come into an MTF because they weren't in your radius. And you had to stay in the network, but the network couldn't see you for 4 months, but the MTF could see you in 2 months, but we had no mechanism for us to make that happen. And so as you're tracking, we have 5 MTFs that I have untethered from every one of our metrics and models to go back and say, if you're trying to take care of your enrolled population and have capacity to take care of anybody that wants to come into your doors, what would you look like? And then we'll start to identify some of those barriers that are, quite frankly, policies and regulations that served the purpose maybe 15 years ago. And so we have to look really hard at our TRICARE rules. We have to look really hard at our processes, but I'm committed to doing that.
Great, thanks. General Krieger, you, General Crossan, and I are all successful graduates of our military graduate medical education system. Can you talk a little bit about the power that the graduate medical education, graduate nursing education, graduate dental education, and even our phase 2 programs, the numbers of trainees that we have in our hospital, and how much that is critical for the 4th generation of the Army?
Yes, absolutely. I mean, as I mentioned, today's graduate medical education, continuing medical education across the board really ensures that we have medical professionals that are ready to take care of our force. And it happens in great quality. We're in a family forum, so I'll mention, so our graduate medical education trains all different specialties. One of them is pediatrics. Out of the over 200 pediatric graduate medical education programs across the country. The military medical system has 2 that have been 100% in their board pass scores consistently. The top two. Oh, they're one of only 2 across the entire country. I mean, that's the sort of quality that we have. And it ensures that we do have physicians, nurses, medics across the board who are able to meet the need. Because we do have areas where it's challenging to practice and where it will be hard to hire people. And so sometimes we have to generate our own. Currently in the United States, we have more people that graduate from medical schools than actually we have graduate medical programs to train. So if the military did not train their own, we would be very sorely challenged to be able to medically support the force. So I think that's critical, and that gets back to our critical partnership with the Defense Health Agency within the military health system, because we must have that care taking place in our military treatment facilities in order to train the folks. Now, there are some things that we don't do as much, and so that's where we partner with civilian agencies to make sure, again, that our folks are getting the quality and the repetitions that are required to make sure they're trained so that the very first person that needs them downrange will get the best care.
And so,
Great.
if I may, Brian,
Sorry.
and what does that mean to all of you is that there's a symbiotic relationship. When you have to train, that means you have to run a healthcare system that has a certain amount of capability and capacity that all of us benefit from, right? So that means you have the Walter Reeds, that means you have the BAMCs, the Madigans, because we need those to train, but we also need those for our military mission, and we also need those to take care of 9.6 million beneficiaries. So that means we, as the Department of Defense, run a huge healthcare system that has lots of benefits for lots of users. And what General Krieger just described is how it generates the healthcare delivery. But what that means for some of us is that if you have some unique health need that we can meet in our system, you get it. And if not, because you're part of a system, we can often buy it. We can often find it because we work in that area. It drives our level of performance, quality, safety to a very high standard that puts us competitive, not just in GME, but in performance. And if you look at the top 100 hospitals, you will find several military facilities right there with them.
Thanks. Jessica,
Yes.
will the Army Central EFMP office have a social media page?
Wow. So we have talked about having a Facebook page. Because we are still trying to reach our full operational capability, that is something that we will continue to discuss. Right now, we have a great community and outreach team for G9, as well as the strategic initiative group that takes care of a lot of our social media. So when we post things out on about EFMP, we actually use those platforms that are available to us, and especially the G9 Twitter page. So right now, we don't have our own, but we are talking about it, and I'm pretty confident that we will soon get our own Facebook page.
Great, thanks. General Crossan, this is, I know you have the answer to this because we've been doing this a lot. How is the DHA monitoring access in both the direct and the purchase care systems? How should beneficiaries report these access barriers? We're concerned that several factors may be contributing to access problems, including some of the congressionally directed reforms, Genesis rollout, workforce shortages across the U.S., et cetera. Any guidance that you can give the community out here?
Yeah, first thing I want to say is I think we're going to settle in and we're stabilizing, right? And what I mean by that is in General Dingell's opening comments, he said something about 7 years were pretty sporty, and that described the period of turmoil that we were going through with lots of things in military medicine. And we're settling in, meaning we have a good structure, as Dr. Line alluded to, where we actually can see access pretty well now down to each of the MTFs, not just the Army MTFs, but the Navy and the Air Force. We have a tremendous amount of support within OSD to get after the civilian hiring challenges that we have. There's a real push at the Secretary and Undersecretary for Personnel and Readiness to get similar authorities with the VA to help us work through the large civilian workforce challenges we have. That is part of what you see in the United States. And so what should you do if you're having challenges with access to care? The first is your local MTF. You have ICE. We send out surveys after every encounter. I don't have a social media presence, but I actually do have a social media presence, whether it be on LinkedIn, whether it be Facebook, whether it be a phone call, whether it's Dr. Line, whether it's the service or the installation. Because we work closely with the service, and I get a lot of my feedback through those service general officers and flag officers that are keeping their eyes and focus on the MTFs. So there's a myriad of venues that you can elevate concerns for access. And the last thing is, as I said earlier, we're looking hard at the model of healthcare. Right now, if you need something, it is defined as an appointment. If you need your lab results, right now, you have to engage us to get your lab results, either through a telecon. Why? Is there not a better way? Other healthcare systems can proactively engage you, and I'm pushing our system in MHS Genesis to define access a little bit broader, right, across the entire range of meeting whatever your needs are. And sometimes that's a face-to-face, sometimes that may be a video, sometimes that may be a telecon, it may be a text, or it may be a chat box answering a couple of questions about where to find the right place to get care. But right now, we don't have that range of opportunities for all of you. And I think we can grow access to mean a lot more than it is right now.
I'm going to combine the next two questions, and it deals with staffing at our military treatment facilities. Both our active duty military, our civilian hires, the challenges of civilian hires. Are we going to allow remote working at our MTFs? And because of Genesis and some other challenges, we're going to be hiring more staff and civilian staff to take care of the myriad of responsibilities at the military treatment facility. So General Krieger, General Crossan.
I can speak to the active duty, as at least Army. Working in the MTFs is critical to our active duty medical personnel, both gaining and maintaining their medical skills and expertise. We've heard General George talk about continuous transformation, the Secretary talk about that. That's something that medicine's needed to do for quite a while because technology evolves, science evolves, and so in order for our medical personnel to maintain their currency, they have to work in the MTFs and they have to see patients. They also have their profession of being soldiers, and so it's always a balance between how much can they work in the MTFs to maintain their medical skills and take care of our soldiers, as well as making sure they are proficient in their soldier skills. And so that is a continuous process where we're looking at, and General Dingell had challenged us as regional medical commanders, is to medical readiness commanders, which it transformed to, is to make sure that they are both technically proficient, being in the MTFs as much as they need to gain their skills and to support the population, and then make sure they're conducting their Army-specific training as well.
And so the staffing is extraordinarily complex in that we have a staffing model where we're dependent on some active duty inside the military treatment facility, and we're dependent upon being able to hire civilians. So General Krieger talked a bit about the service member, those that are wearing uniforms, whether it be one of our techs or whether it be one of our docs or one of our nurses. And the Army prioritizes the uniforms being in the facilities because, as all you know, senior mission commanders see the totality of the requirement. They don't just see readiness of service members, they also care about the readiness and the needs of the family. For the civilians, there's a shortage of nurses, 250,000 in protected projected to grow, and there'll be a shortage of physicians. And the right answer is, yeah, we're putting a lot of energy into it. I mentioned a lot of support and fighting for more money, but we're also going to have to look at how we deliver care. We're going to have to look at that model of care that is dependent on a resource that we're short on. And are there other ways and better ways, as I mentioned earlier, to not force you to come to the MTF every time you need something? Can we not meet you where you're at and project some of our capabilities? The last thing I'll say is we spend a lot of time in healthcare talking about what we do to you or for you, and I have the agency on a trajectory on what can we do to keep you from actually becoming a patient. We spend a lot of time, a lot of resources, and you get good care when you come through our doors, but we really should put some time and energy on how do we manage you, whether it be nurse case management, if you have a chronic disease, and we're engaging you proactively to keep you healthy, which then leaves capacity for others who need to come in through the doors, right? So it's not a simple answer. It's not a quick, easy fix. It's going to take us some time to get the right balance of resources, but there's a tremendous, as I said, amount of support within OSD to make sure that we at least have the right authorities, responsibilities, and then I always say, and the money, so that we can bring folks on.
So thanks, Senator Carlson, General Krieger. I have one final question, and then we'll wrap it up. And this deals with the total Army family, the Guard and Reserve. What do you see as the role of the Guard and Reserve in delivering health care within the military treatment facilities? And then what do you see as the role of the DHA in providing access to our Guard and Reserve for their health care benefits?
So I can start with the role of our Guard and Reserve. Our structure is such that there can be times where you may see Guard and Reserve medical personnel in our facilities. That's a little less now because of some changes that happened in the law a few years ago. But we absolutely partner with our Guard and Reserve members and those who are on active duty for more than 30 days, not only within the facilities, but also at our mobilization generation sites that would help prepare us if we did have to mobilize in a large scale.
And so the agency has two responsibilities. The first is for the readiness of the force. There's a big contract that we execute on behalf of the services for care for the Guard and Reserve for their readiness. And we've put a lot of energy and focus on that contract, getting it to perform, to increase the readiness that no one is happy with in the Guard and Reserve. And my assistant director for support meets regularly, and I actually get a meeting next week to see where we're at in that. So for the readiness of the force, there's a contractual oversight. But then the other part is we're in full support as any Guard unit that wants to train in an MTF. We're here to help facilitate whatever MOAs, agreements you need to be able to, if you want to bring your unit into an MTF to get some training, you want to bring your unit in MTF for a weekend to get some of your readiness done. We are, I believe, very supportive of that because that's the guy that does that. And so I'll just put that out there.
We are very supportive of that. So thank you, panel. I'd like to offer the panel an opportunity to provide some thanks and some closing comments. So Jessica, first over to you.
Thank you so much. I am so glad to have been part of this panel. As I sat through the family forums yesterday and earlier today, I've learned so much in different ways that I can leverage. EF&P can be leveraged for other areas that touches the families. But one of the things that I want you guys to take away is that EF&P is a complex. It is absolutely a complex program. But it takes all of us. It takes commanders. It takes family members. It takes the soldiers. It takes all of us to stand shoulder by shoulder and to move the program forward. We are here to make sure that the family is taken care of so that the soldier can get after the mission. If we take that away, if we do not take care of the family, the soldier will absolutely not be available for the mission. And so as we move out from this, I would just ask, to, continue to give us your feedback, which, we absolutely take that feedback and we make improvements. But I also ask that, keep in mind that family. The family is the one that is making sure that the soldiers can do what they do. And so if we don't get this right, we are letting down the mission and we're letting down the family. So again, thank you guys so much. I appreciate the invitation. And as my program manager will probably think is, I'm crazy, but, I was excited to be here and hear the feedback. I'm glad that there were no tomatoes and eggs, right? So, and thank you so much.
Thanks, Jessica. General Krieger.
Sir. So I echo Jessica's thanks. I'm grateful to be here as a soldier for 28 years, as a military family. Joe and I have one son who is currently a soldier as well. So we share with you that our family, both as their own care as they're serving, and then all of our children get care in this system. So we're very committed to ensuring that we are part of the solution. General Crossland referenced, we've been undergoing transformation for the last 5 to 7 years, and as any transformation, there has absolutely been challenges as we've done that. Army medicine remains committed to your care, to the care of your families, and we're really excited partnering with DHA to make sure we continue to build upon that system that you've deserved, that you've earned, and that we are proud that you're able to get your care here.
Great, thanks so much. General Crossland.
Hey. Yeah, thank you. Thanks for being here. What I'd want you to take out of today's panel, if nothing else, is from the Defense Health Agency perspective, our mission is improving health and building readiness. And I put it in that order because we are responsible for improving the health of all 9.6 million beneficiaries. Families, retirees, their families, service members. And when we do that, we will build readiness for the force. And that sounds nice, and that anytime, anywhere, always, all sounds good, but I promise you as you sit here, the agency's getting after changing that model of healthcare, starting with from the patient's perspective. How you engage us, and how do we make that work to make you healthier? And how do we align resources and metrics and the right thing to drive our whole system to focus on how we do a better job of taking care of patients, and then ideally moving from patients to people. And how do we work in that white space to keep you out of our facilities and to put control in your hands to keep yourselves healthier. So I appreciate being here today. I just want you all to know this is a journey, and it's going to take a minute to get there, but we're pushing hard, and that minute's not going to be beyond my directorship, which is only 3 years. So you'll see something long before I leave, because I have to come back next year.
So there are some questions that we didn't get to, and I know I saw somebody walking around in the back with a lot more questions. So we'll work with the Family Forum to try and get you the answers on Facebook or however it is that we can get you the answers, because there were some that we just couldn't get to in the time that we were allotted. Thank you all for being here. I'd like to close this out by bringing Corey Weathers up onto the stage and kicking us off the stage. Corey, over to you.
Dr. Line, as an EFMP family ourselves, this is an important topic that I know that hits all of us. When we talk about health and wellness, it really does impact our psychological well-being. It impacts everything that's happening inside of our home. And for us, the EFMP program actually kept us from going to a remote location where I think that we probably would have been at a breaking point as a family. And it actually helped our families stay in one place and have the stability that we need. And so thank you for evolving that conversation. And as a TRICARE provider and also a spouse, I can also say that no system is perfect. And so I just want to say thank you for an honest, authentic conversation that's really grounded. And just a reminder that no system is perfect, and that it's all people and everybody in this room together, and including you guys up here. We're all human beings doing the best that we can to move the needle as best as we can. So thank you for a great conversation on that. So before you go anywhere, if you didn't know, we can't make changes and make conversations like this better without you giving feedback. So there is a QR code that's going to be on your screen. This is a great time for you to actually pull out your phones, because any other time you should not be on your phones. But now is that time. And so seriously, though, we say all the time, what kind of conversations do we need to have every year? And this is, I can tell you for a fact, based on what kind of feedback you give. So you can do a quick survey, and guess what? You can be in the running for a digital swag bag just like this. And did you know also that there are resources in here I could have used 10 years ago that I just looked in here and realized I could have been a better mom and a better wife had I had them. So please do the survey, give us some feedback on that. And wait, there's more. We talk about all the time the importance of having a more modern approach to information distribution, a more modern approach to reaching the next generation. And guess what? We do that through our phones. So I know we've been testing a lot, things like apps, feedback using QR codes. So MCOM, the U.S. Army Installation Management Command, that's a mouthful, has created, and they're piloting an app. So use your phone again. I did this in 2 minutes right before this segment started, where you can do a very quick survey, and let me tell you why it's important, because I did it already, okay? So here's the deal. What would it be like for you to go to an installation and before you even get there, to have live feedback on what the traffic is like at the gate, right? What would it be like for you to know before you even go to the commissary if it's open, right? Or if it's closed early, because it always does on Sunday, and yet I always forget that, right? So things like that is what they're trying to pilot in this app. So if we're going to have an installation app that reaches the next generation and helps you navigate resources faster, they are piloting how can they tailor your experience, your personal experience with the app. But they can't build it if you don't tell them what we need, or even better, what we don't need, right? So please, it's like 10 questions max. So please take that. If you would like a demonstration of that, it is booth 2549, the Installation Enterprise Assembly area, okay? So 2 surveys. You may be survey weary, but it's really important. Okay, we are going to transition. That concludes this, this topic specifically. Great, right? It was really great. But wait, there's more. We have another forum coming up. Also near and dear to my heart is the spouse employment. Please stick around for that. It is a huge issue that we need to do. We're going to have 5 minutes just to switch the mics to the next panelist, so just talk with a friend. You can also go to the Army Wellness if you're really stressed right now and would like to try biofeedback. It's right outside the door. And also get a signed copy of the Army Spouse Handbook by Ginger Perkins. Thanks, guys.
Hey, how's it going? Good. the day going? Ugh. So are the shoes I'm in.
You don't have a sticky down by you, do you?
Oh, what was it? Okay.
Is IT ready? I mean, them. They're all right? If you would please have your seat, we're going to start in 1 minute. Thank you. If you would kindly take your seats and silence your cell phone. The last one to sit down has to lead us and sing the Army song on stage. And it won't be me. All right. If you could kindly close the doors in the back, we're going to get started. All right. Thank you. Okay, so welcome back, everyone. I hope you're enjoying all the forums so far. It's now time for our next forum. I can't tell you how personal and near and dear to my heart also that this spouse employment topic is so important to all of us. It's been a huge part of my personal journey throughout my whole Army life, which is a long time, and during my transition into retirement as an Army spouse for life, and it is still an important part and critical component when you go into retirement. So at this time, I want to also thank again our national partner sponsor, National University. Thank you so much, not only for sponsoring today's forum on both panels, but your continued support on spouse employment. So let's give National University a huge round of applause. So we have made great strides in spouse employment, especially since I first became the Army spouse, right? And today the Army provides reimbursement for professional licenses and certifications, especially after a PCS move. And if you didn't know, in conjunction with the Army, AR offers eligible spouse assistance as a loan or a grant in support of that. The Army also provides professionalized employment readiness programs with staff certification, and if I believe those are master level certifications, implemented military spouse co-working spaces at select installations, and simplified the home-based business application process. And the Army also continues to improve information and resources for those of us overseas. The Army, along with the Department of Defense, is working hard to reduce spouse unemployment and underemployment. But guess what? They're not in this alone. There are hundreds of corporations. Many of you in the audience today are watching online, small businesses, non-government and government organizations, all coming together because they care about our military families, truly. They want to help out. And they're collaborating to improve career and employment opportunities for our military spouses. And you will hear from some of them today on the panel. And I can tell you firsthand that this panel is not only experts that you will hear from, but they are invested because of personal experience and their dedication to our service members and families in our communities. But we also want to hear from you. So as you heard throughout the last couple days, feel free to be part of the discussion, right? We have question cards for you. Please write those down and wave them in the air. We'll come get them from you. And online, please submit your questions, tell us where we're at and where you're at, and we'll give you a shout out. So at this time, I would like to welcome our guest speaker and moderator, someone I adore, Ms. Meg O'Grady. Meg has been instrumental in the advancement of spouse employment for over the years, and from being a senior leader in the Department of Defense in creating the Spouse Education and Career Program, working with Syracuse University Institute for Veterans and Military Families, creating and launching the Coalition for Veteran-Owned Businesses, to her involvement with the Department of Labor Veterans Employment and Training Services. So if you didn't know, Meg is currently the Senior Vice President for Military and Government Programs for National University, our sponsor today. So welcome, Meg.
Thank you, Holly. Thank you. Thanks, Holly. First of all, it's so great to be here today. I'm going to set my questions down here because we're going to have a panel here, but I thought I would just take a few minutes to kind of go through some of the history of military spouse employment, and yes, I am that old. So I'm going to tell you a little bit of a story about how I became the Forrest Gump of military spouse employment. And so in 1991, we went over to Germany, and right out of college, I didn't have my degree yet, and so My ex-husband was stationed there. And the only thing I knew about was the exchange. So I thought, okay, I'm going to put on a suit, and I'm going to go to the exchange, and I'm going to fill out an application, which is a great job. But I walk in a suit, I mean full-on suit, like I was ready for my power job. And I go up, and they hand me an application, and they say, well, you know, the Wedgwood store upstairs is hiring. You might want to go up there, too, because I guess I look classy enough to be selling Wedgwood china, right? And so I go in, and I say, hey, I'm here. I'd like to sign up for a job to work for Wedgwood. And the lady said, well, you know, I'm actually leaving in 6 weeks. Would you like to be the manager of this store? And so that's how I started. I was the manager of the Wedgwood store. I never made any money, but I have a heck of a lot of china. So fast forward 5 years, and in between, as military spouses do, you know, I had several other jobs on the side. So I was teaching aerobics. I thought that was really fun. And from teaching aerobics, I decided I wanted to go into community health. How I made that leap, I'm not really sure. But I decided that's what I want to do. And I'm going to go to Johns Hopkins and get my master's in public health. And we didn't go to DC. So we ended up at Fort Hood. I said, well, I'm going to do the next best thing. I'm just going to walk into the community health office, and I knock on the door of the commander of community health at Fort Hood, because I was so bright-eyed and bushy-tailed, and it was Colonel Gonzalez. And Colonel Gonzalez was a community health nurse who was a Vietnam veteran, and she was tough as nails. So I bop on into her office, and I say, hey, I'm really excited about learning about community health. Would you mind, like, I can volunteer, I can file, I can pour coffee. And she looks at me, and I started getting a little scared. Just silence. She says, do you smoke? I said, no, no, I don't smoke. She goes, good, can you teach a class? I said, yes, I can teach a class. She said, good, we're doing this whole smoking cessation program. It's an Army-wide research program, and we need somebody to do surveys, but we also need somebody to teach a smoking cessation class. Do you think you could do that? Yes, ma'am. So I did that for about 2 months, and she came in to me and said, hey, the contractor needs somebody to be a research associate. Do you want to do that? They'll pay you. I said, that sounds great. I'll do that too. 8 months later, the master's level licensed nurse, who was our health promotion manager, decided she was going to go back to school. And she was a contractor. And so they said, Meg, would you like to apply for this position? I said, first of all, I'm the only non-licensed person in this place. Second, you know, I kind of like my job now, and I'm not a master's level nurse. And our health promotion manager was just amazing. So I knew I couldn't fill those, you know, that whole imposter syndrome. So Colonel Gonzalez sits me down. She said, look, we don't need a nurse here. We need somebody, you know, who just runs around and meets people, talks to them, and tells them about health. I think you can do that. I was like, yeah, I think I can. Okay. So I started as a contractor. 6 months later, she said, we're going to make this into a government job, and that's how I got my first federal job. I have 3 more stories like that, and that's how I became the Forrest Gump of military spouse employment. The reason that I say that is because I never really thought about how I, as an Army spouse, was able to just parlay my need to serve and find ways to contribute to my community into employment. And so when I got to the Pentagon, my whole job was building the Spouse Education and Career Opportunities Program. And in fact, you should all be very proud, because when we did the Military Spouse Employment Partnership, we actually took the Army Spouse Employment Partnership and all 50 of those founding members, and it became the DoD MSEP program. So you should be very proud as an Army for being so innovative. And it's turned into such a sensational program, which Patty Barron's going to talk about today. But what I wanted to tell you is when I got there, I had to go out and speak and talk, and people would say, well, how did you get to be successful? You didn't have a college degree for a while, you stayed home for 7 years to raise your child, and I said, you know, I don't know, I think I'm just the accidental executive, and that's how we came here today. So we have a really fun panel for you today. I do want to put in just a little plug if you are a military spouse, because it's really important to us. We have 30% of our students who are military affiliated. Out of 44,000 students, we're one of the largest nonprofit private universities in the entire country, and 95% of our positions are remote. We're trying to add more military-affiliated folks, and military spouses are wonderful. I have a whole team here of military-affiliated veterans, spouses, kids who were military kids, and so they move around as we need them. They're all remote. You guys can just give a wave. So if you're interested in working for National University, we would love that. We don't just need teachers, faculty. We need finance and IT and cyber, and you have to remember that as you're going around to look for employment, because any organization needs those kinds of infrastructure things. The last thing I'll say is I'm so happy to be back in Army land. Oh my gosh. I live in San Diego. Our university's in San Diego. Everywhere I go, I have to qualify myself and say, I'm from the Army. And so I had a Navy colleague who we were training together, and she said, Meg, what do they call it when you have stories, like in the Army? You know, like, how does that go in the Army when you're telling war stories? And I said, well, I think, you know, we just always say, like, there I was. That's how it always starts, right, in the Army. There I was. And she said, oh, because in the Navy, we call them sea stories, but we call yours lies. So the best thing that I could say was, well, nobody ever went over to their next door neighbors, knocked on the door and said, hey, do you want to go into the woods and play Navy? So if you can think of any good rejoinders while we're talking today, please do that. I'd like to welcome our panel up to the stage. Come on up. All of you. Are you afraid now? You guys are like a little afraid. So today we have a fantastic panel for you. These are friends that I've worked with for probably at least 20 years. Every single one of them is an incredible contributor to the innovation and the progress of military spouse employment. And so I'm going to let them introduce themselves, and then we're going to go into a few questions, and we'll make sure to leave time for questions at the end. How does that sound? Not good? Good?
Sounds
I know I'm standing between you guys and happy hour, so we're going to make this good. It's going to be worth your time. Okay, Ms. Patty Barron.
Yes. Hello, everybody. I'm so excited to be back home at AUSA. Yes, and oh my goodness, you all, how many people are in this building? It's unbelievable. So congratulations to AUSA. And I also want to congratulate Holly Daly, Thea Green, Army G9, for all of the work that they did in putting these forums together, because they have been fantastic, Holly. They absolutely have been. So I'm Patty Barron. I've got a fancy title, which you can read about, but really the way that I identify myself is as an Army spouse. I fell in love with my soldier when we were both in school, and then we said I do, and I followed him for 30 years in this crazy Army life that we led, raised 3 kids. And then I started in the nonprofit world, started at NMFA, and then I went over to 0 to 3 for a little while, and then found myself as the Director of Family Programs for AUSA, which was a wonderful, wonderful experience for me. And I'm just so proud of what you all have been able to do to really just continue to excel with the family forums that are here. So that's who I am, and I'm very happy to talk about what the Department of Defense is doing to support military spouses in their employment and with childcare too.
Thank you, Patty.
Hi, I'm Elizabeth O'Brien. I'm our Executive Director at Hiring Our Heroes. Have been there for about 7 years with a short stay away from it for 3 years, where I was CEO of an ed tech company and recently returned in January. I've been an Army spouse for almost 20 years, and I like to think that I've navigated employment oftentimes in spite of the Army, certainly doing great partnership because of the willingness my husband has had to come alongside and make sure that my career has been as important in our lives as his career was or is as well. And as I look around the room, Holly, I want to thank you always for your fierce advocacy, your loyalty, your willingness to lean in, and Patty Brown in the back, who's been part of our lives for almost those 2 decades and watched a lot of the pathways that I've navigated as well. And so able to take those lived and shared experiences and lean in to ensure that we're creating pathways of economic opportunity on a daily basis in partnership across the country for military spouses.
Well, good afternoon. I'm Stan Kurtz. I'm with the Small Business Administration Office of Veterans Business Development. I want to thank Holly again. This is a great event. I want to thank Meg also, and I was hoping that she would give that sea story, but she didn't. So, as a sailor, I was looking forward to that. Always a good sea story, but she didn't go on with that. So, I've been with the Small Business Administration for 6 years, and prior to that, I was in the great state of Texas, where I worked Veterans Employment Services, and then before that, I worked in Florida, also working with veterans and military spouses on employment. And so I just celebrated my 40th anniversary with my wife, same one. Same person. And so we look back a lot over my career, 23 years in the Navy, and every couple of years she had to look for a job. And so, spouse employment is very near and dear to my heart. I work programs at SBA for military spouses and entrepreneurship. So again, I've been doing that for 6 years, and we're always looking to improve on that and get more military spouses in the entrepreneurship space because it's a great option. Nowadays, with the internet and all the services available, all the programs available, so entrepreneurship is also a great option. So just great to be here.
Hi, I'm Tom Trail. I'm a senior behavioral scientist with the RAND Corporation. Those of you who know RAND know we're just a bunch of policy nerds. Those who don't know RAND, we're a nonprofit, nonpartisan public policy research corporation that has a special relationship with the Army to provide strategic research on the issues that are really important to the Army, and that includes spouse employment. So we've been working with Army G9, doing research on spouse employment, and we also do research with military, community, and family policy on their programs and how they work for military spouses. So I'm very happy to be here today, and hope I get to talk a little bit about the data that we've been collecting.
So you can see that Holly and team have assembled this incredible group of panelists. So we're going to get right into some of the questions that we have. And Patty, I'd like to talk to you first because I think it gives a really good overall picture of why is military spouse employment so important, and can you relate that with the economic security of Army families?
Absolutely. Yeah. So as the DASD of Military Community and Family Policy, we have 8 directorships that we oversee. One of them is the Military Community Support Programs that you heard Erica Slayton this morning. If you're here in the room, she did a fantastic job of talking about the resources that we have. But SECO, Spouse Education Career Opportunities, is one of them. And one of the things that struck me about this morning and also yesterday afternoon, we were discussing mental health. When you're thinking about military spouse employment, I almost think that you have to put the two together. You have to put economic security together with healthy mental wellness, if you will, because so many of us will graduate from high school or college, we're ready to take on the world, we're going to go after it, and then we fall in love with someone that wears a uniform. And all of a sudden, your story, Meg, is my story, is Liz's story, and many others, because I see a lot of familiar faces in this room. And I know what your stories are. I know that somebody wanted to be a principal of this wonderful little school, in Alabama, next to the Fort Benning border, it's called something else now, sorry. And then I also know that a friend of mine took a long time to get her PhD. But we don't give up on the dreams that we have. We keep trying to figure them out, as you have, Meg. However, in today's world, it's not, the norm is a 2-income family. And we take that opportunity away from our military spouses because of the very transient life that we lead. And not through anyone's fault, it's just the way that it is. So when you're moving and when you're having to relocate, get the kids all settled, get yourself settled, and then start looking for a job, sometimes any job will do, just because you knock on a door and you say, hi, I've done that many times myself. Hi, here I am. Here's what I can do. What do you need me to do? And then you get hired and then you prove yourself. But just when you're getting to the point where you're proving yourself, guess what? You've got to move again and you've got to start all over again. And so that impacts your ability to contribute to the financial wellness of your family. It also impacts your own well-being, your own sense of self-worth, and your own ability to contribute to not just your family, but to society writ large. And so it's incredibly important to be able to provide those resources to our spouses, which I'll talk about later, but it's hard. It's hard, and I see you and I hear you, and I know how difficult it can be.
And if you're ever, all of you know military spouses in here, and that's why you're here, but I never realized how abnormal it was when somebody asked me, how many times have you moved? And I said, 17 times in 23 years. And they just So if you're a military spouse and you want to impress somebody, you know your number. You know your number, Patty. What's your number?
It was 18, I think. Yeah.
And then Liz, I'm going to ask you a question, but what's your number? Do you know what your number is?
At one point, we lived 7 places in 9 years.
Great job. Great job. Okay. I want to ask you to talk a little bit about innovation. So we're kind of going broadly here, sort of overview. And Hiring Our Heroes really is disrupting the military spouse hiring space. I know I was there to launch MSEP back in, like 2011, when Hiring Our Heroes was just starting. And it really morphed very quickly and grew into something that is much more than just a job fair, more than a job board. So can you talk about the MSCAP program especially, but overall the collaboration with Department of Defense and what unique strategies you all have to serve the military spouse community right now?
I think when you look back to 2011 when Hiring Our Heroes was launched, the company was responding to the crisis of veteran unemployment, and we were basically, for lack of a better term, performing triage. How fast could we get transitioning service members, veterans, into a pipeline? By 2014-15, we were starting to see incremental success around ensuring our veterans had a place to go to work. And that's really where we started to be able to say, how can we create programming that puts military spouses, that'll put veterans transitioning service members into an actual pathway? And focusing specifically on military spouses, what we know is that we have to cut that time down where a military spouse is moving and when they're unemployed. And you know, to your point around mental wellness, we also know if a military spouse is employed, it impacts the transitioning service member tremendously in that it gives them a little bit of breathing room because they don't have the pressure economically to secure a job. And so that goes to the transitioning service members' mental health as well. The most, I would say, disruptive and innovative program that we've been able to launch certainly has been the recent Military Spouse Career Accelerator pilot, which we hope someday will be a program. And that was in collaboration with the Department of Defense and with Deloitte. And so the Congress mandated through NDAA a $5 million pilot program over 3 years. What we decided was certainly we didn't have to reinvent the wheel. We had to leverage what existed out there already and utilize it specifically for military spouses. So we're disrupting by putting an opportunity for access to a pipeline that's highly educated and skilled and also has a really strong desire to go to work quickly. And so in collaboration with Department of Defense, Patty's great efforts, we are placing military spouses into internships. And it's specifically very impactful because we're not placing 21-year-old college grads. We're placing people with shared and lived life experience alongside more educated than their peers as well. And so we launched that program in January. This is not easy, right? It's a lot of hours, a lot of preparation, a lot of scrutiny. And so we are about 3/4 through the first year. And we know that we are tracking to meet the 400 fellows that Congress mandated that we have to meet in the first year. So we have some great takeaways for it, too, that we feel like are lessons learned. We've had about 4,000 military spouses start initial inquiries, right? That means they're curious, they've put their name in the pipeline. About 1,300 of those have completed applications, and from that we found about 800 plus that are ready to be put in front of an employer potentially for interviews, et cetera. So we have a very stringent vetting process alongside our great partners at Department of Defense to make sure we are putting the right candidate in front of our employers. We have 167 employers that have stepped forward this first year. This is where innovation comes in partnership with the SBA, with DOD. We don't do anything by ourselves. This first year, we knew small and medium-sized businesses were going to play an integral part in the success of making sure spouses had a pipeline. And so I think across the board, we've been very pleased and very happy. We are looking for the country to respond at large as we go into 2024 that we need more employers to come to the table. We know that we have the military spouses and look for year 2 really to ramp that up and start to move into those medium to large size businesses as well. But cannot stress enough, all that's old is new again, right? We've taken internships and we've disrupted how companies view military spouses and put them into the pipeline. So to our great partners. Really appreciate the tremendous partnership in creating change.
It's a really great program. You all doing a fantastic job. And I would also say that the number and the percentage of spouses that are being then offered permanent positions are pretty good.
Yes, so we've had 300 and I believe just about 310 fellows go through. 65 of them have been direct hires. The others have gone through the fellowship and then received their job offers on the back end. So we're pleased about that, and thank you.
What an incredible program. And what a great way for military spouses to really kind of learn about cultures of different companies and really kind of test that out, because they want to test out the company as much as the company wants to test out their talent, right?
That's right.
Great. Thank you. So, Stan, I think from an overview standpoint, we're talking a lot about employment, but for a lot of military spouses, that employment is entrepreneurship, right? They want to own their own business. They're small business owners. We're starting to see more and more military spouses really move into kind of the real tech space and sort of venture entrepreneurs as well. So can you tell me, just from a broad perspective, what are some of the questions and concerns you get from military spouses around entrepreneurship, and what are some of the resources that you have to apply to that?
Yeah, sure. And just to kind of go off of what Liz had talked about, we partner with Hiring Our Heroes, and I'll just give you an example of entrepreneurship and how it's really growing in the military spouse community. 2 years ago, I think it's 2 years ago, we did a military spouse entrepreneurship summit. It was virtual. It was 2020, I believe. We had 1,200 military spouses sign up. 900 actually showed up. And we stepped back and said, whoa, there's a market here. And so we ended up partnering with Hiring Our Heroes and the Rosie Network, and we were doing monthly, we were doing webinars for military spouse entrepreneurship. So we continued that for a couple of years, and then Hiring Our Heroes moved into Amplify. And so now we partner with them. We do a portion on entrepreneurship. So it's really grown. Entrepreneurship is a great option to employment because you could take that business, in this day and age, you could take that business overseas. You can start it overseas, come back, or you can move from state to state. So that business can stay with you, especially with the online platforms. So it's a great option. One of the places to get started, our main program is Boots to Business. Now, Boots to Business is a program that's held on military installations as part of the Department of Defense Transition Assistance Program. It's a 2-day entrepreneurship overview. And what I like to say is when you finish up with that course, you're not ready for Shark Tank. It's just an overview of how to get started. Some of you are ready for Shark Tank? Okay. It's just an overview, just kind of get you started. So military spouses are not only eligible for that course, but also encouraged, right? So we know that starting a business or growing a business is a family affair. And it's for those of you who have transitioned out of the military and thinking about it now, maybe more financially stable, and thinking about starting a business, but you can't get on the military installations, then we do Boots to Business Reboot, which is held off of military installations. So again, military spouses are invited, encouraged to take those courses, and again, it's an overview, basically the same curriculum. Now, one of the things that we found through talking with a lot of military spouses and getting feedback, a lot of the military spouses believed that they, one, weren't eligible for those courses. Two, it was a little intimidating. You know, you walk into a Boots Business class that's held on military installation. It's made up of transitioning service members. And I've seen this firsthand. You get 1 or 2 military spouses. You know, it's a little intimidating in some cases. So what we did was we went back and we rebranded the Boots to Business Reboot course, and we now call it Pathway to Business. So it's built on almost the same platform as Reboot. We did add some topics there that are specific to military spouse, but what we found was it's the peer group of military spouses in those courses. So we just launched that in July. We just recorded a session on the 25th of September, which we'll show to overseas military spouses. So they can sign up for it. We'll actually, it's a course that actually we had here in DC, so it'll look like the course is actually happening, and then we'll have people in chat answering those questions. So we've come a long way. We started tracking military spouses in Boots to Business courses in 2019. We kicked off Boots to Business in 2013. We didn't start tracking numbers until 2019, where we had 100 military spouses for the year. This past year, we had almost 600. So we're getting there, and a lot of that has to do with getting the word out. and marketing that program, getting more military spouses into those programs so they can launch and start their business. And we also have some follow-on courses. So if you take the Boots to Business, Pathway to Business, or Reboot, you're then eligible for Revenue Readiness, which is a 6-week virtual training class, a little bit more intense. So you'll get some homework, you'll see your classmates, and at the end, when you walk out of that, you'll have your business plan and you're ready to go. And then you can transition over to the Veterans Business Outreach Centers, the small business, the SCORE chapters, which are mentors, women business centers, SBDCs, which are small business development centers. All of our resource partners are there to help you through your journey.
Wonderful, thank you. So for those of you, we're looking at these national level programs that supplement the great work that the Army is doing on installations. So if you're working on installations, I hope that you're learning a little something, or if you already know about these programs, that's fantastic, then it's working. But please spread the word about these programs as we go through. Now I want to switch to Tom. Rand was such a great partner when I was in the Pentagon, and we were really trying to measure success. And as you all know, having a program and not being able to talk about how well you're doing or how you need to change it is really difficult. It's really difficult to keep programs going unless you can really show the data. And so Rand has been a great partner, both with the Army and DoD. Can you tell us a little bit about the state of military spouse employment today, what you're finding?
Sure. So I'll just talk in general first. But we've established something I wanted to talk about today, especially today's Army Spouse Panel in cooperation with G9. Some of you spouses who are here or online might actually be part of that panel. Basically, it's a group of Army spouses who have volunteered to participate in surveys over time, multiple surveys. They're a representative sample of Army spouses. So we have junior enlisted spouses, senior enlisted, junior officers, senior officers, those with children, those without children, so we can make adjustments to to show what's representative among Army spouses right now. So we do this every 3 months or so, and so we did our most recent survey in May. Actually, we just finished a survey about a week ago. We don't have that data all finished yet, but from May, I can tell you that the unemployment rate among Army spouses is 19%. It was 23% in January, so it's gotten a little bit better. But that masks a lot of churn in spouse employment. Even between January and May, there were about a quarter of Army spouses who lost their job. Wow. And there were about a third of Army spouses who were started working when they weren't working before. There's about 10% who went from full-time to part-time. There's some who gained hours. There's a lot of churn, and I think that goes to these different entrepreneurship and different programs to help spouses sort of smooth that out a little bit, because some of it's related to PCS moves for sure. Some of it's related to losing childcare. Some of it's related to gaining childcare. Because you didn't have childcare first, you get childcare, then you get a job. Maybe you move from a place where there were no jobs to a place where there are more jobs. So it really varies between spouses, and there's a lot of churn. And that's one thing I think that programs can really help with, especially entrepreneurship programs. We've done an evaluation of the MyCAA, which I don't think we've talked much about, the My Career Advancement Account. So it's a $4,000 scholarship that's available to spouses of junior enlisted service members, and I'm going to get this wrong, Patty, so the junior officer spouses as well, right?
So we just expanded it from E1 to E6, W1 and 2, I think, right? and O1 to O3.
Right. And we tracked a cohort of spouses who signed up for MyCAA in 2010 to 2011 and compared them to a matched cohort of spouses who were similar in their employment histories, had children, lived in similar areas, so they had the same sort of opportunities that we could match on, at least in the data. And what we found is that being part of MyCAA, having that scholarship, getting a certification or getting education to help advance your career led to a significant increase in spouse employment over time, about 6%, and it's lasted over 7 years up until 2018. So it really boosted employment among those users compared to very similar non-users. Also, it increased their their income 3 times. So they are making threefold more in 2017 than they were in 2011. And it also increased retention, which is something that you also have to show in military programs. Like, what does it matter to the military? And it increased retention an average of 10% over 10 years, which is actually quite a big effect in retention. And it's just for one time, one output of funds to help a spouse gain an education, gain a certificate, is producing a pretty big effect in retention over time.
Thank you so much. That's the first I've heard of that data, Tom, and that was us in 2010. So I'm so glad to hear it. It's and a lot of that data, the demographic data and things like that, can be found at Military OneSource as well, right?
So let me give you a little bit of, because I'm older than many people in this room, and let me tell you, when I first got to this seat and I went right to Military OneSource, I was trying to figure out, how do I navigate this? And what I didn't know is that there's this little bar at the top of the page, and if you push that bar, this entire what banner opens up, and all these other programs are up in that banner. And so my SECO is up in that banner, which is something I'm going to talk about in a minute. But there's also kind of I can't
menu.
think of the word. Menu,
Yep.
drop down. Thank you very much. Where you will see research at the bottom, and we put an awful lot of our research on that particular link. And what I can do is, I have a good friend of mine, Ty, who is here in the audience. And Ty, if you can just write a note that we'll send the link to that research menu, so that you could see all of the great opportunities that we have there for you to get smart on some of the things that are working. And things are working, but it's constantly having to make sure that people know about it.
Do you want to talk a little bit more about some of the resources that are available since we're on Military OneSource?
Yes, since we're on Military OneSource. What I can tell you is it always surprises me, and it shouldn't, because I remember when we were down at the installation level, in companies and battalions and brigades, you only kind of thought about your little footprint, right? What was available to you on the installation. And I got to know my installation resources pretty well. But that was before the internet. Like, that's how old I am. That was before the internet.
I'm that old.
And now what we try to do with Military OneSource is we try to augment what you can find on the installation through the Employment Readiness Program. And we offer so many different resources. And I know Maria McConville used to say this all the time: if there could just be one place where you can go and you could just find everything in one place. Well, Military OneSource does that to a certain extent as far as resources go for in a myriad of different topics. But as far as spouse employment, you want to look for the Spouse Education Career Opportunities website that's in that banner that I just told you about. And what I love about SECO is that there's things there. There's this program called My Step. And if you think about that very young spouse that's first coming into the military, and they're not quite sure what to do next, or gosh, I want to work, but I don't even know where to start looking or whatnot. The My Step program kind of helps that spouse through that initial entry-level phase. The next one is the mid-level phase for those spouses that have been, kind of with their, I can say soldier here, with their soldier for, maybe 10, 12 years. And then there's another phase where they're actually going to be transitioning out. This is the part that I really like to foot stomp, because so many of us have dedicated our careers and our lives to supporting our service member, to supporting our family. We kind of reinvent ourselves everywhere we go. But all of a sudden, you're looking at that transition, like you were saying, Liz, and you're going, oh, no kidding, I think I really need to think about what I want to do next. Maybe the kids are older or whatnot. And that final My Step helps you think about that. What do you want for this transition, and what are you hoping that you're going to be able to do when you're completely out of the military? We also have those, and I know Erica Slayton talked about it, the SECO career coaches. These are no kidding master's level coaches that's what they do. They're professional career coaches, and they will work with you for as long as you want them to work with you. So you all in the room, you're smart. I know you know about this stuff, but I need you to go out there and tell the spouses that you come in contact with, the ones that kind of say, I can't find a job, oh my gosh, I'm having a hard time. Make sure they are connected to their Employment Readiness Program office on an installation, I think that they can do that virtually as well as physically, and make sure they go to the SECO website because it's so good. We pour so much energy and money into these resources, and we want them to be used. And when they are used, we get such great success stories. I'm really not kidding. I'm not just saying it because they're paying me to say this. You really get these great success stories. And so MySeco, we've talked about MSCAP, we've talked about MyCAA, the $4,000 scholarship, and I'll talk a little bit about childcare later if you want me to. I can wait.
Sure. So the other program that we love at National University is Military Spouse Employment Partnership, and that we were a new partner last year, and there's more than 400 employers now, right?
No, much more than that. So the Military Spouse Employment Partnership, thank you so much, is where industry has raised their hand and said, we will look for and hire and retain military spouses. The hard part is the reporting back, because not every military spouse identifies when they get a job. But for those that do, we do know that we have hired to date 275,000 spouses. That's gone up by 25,000.
Wow.
275,000 spouses, and we have close to, when we're going to have the MSEP new partner induction next week, we will have close to, or a little over 700 partners.
Wow.
Now, why am I not giving you an exact number? I always ask my team, why are we not giving an exact number?
So many keep coming in.
Because we also are vetting them.
Yes.
We're also going back and saying, are you doing what you promised you were going to do?
Mm-hmm.
And we have a system where we check, and if they aren't, we ask them, maybe this isn't a good time for you to be an MSEP partner.
Yeah, it's pretty rigorous. We got 100%, I made sure. So Liz, I think while we're on the subject of employers and employment, I know for us the progress and where we're looking to the future as a university is around skills-based training. And so we're actually incorporating certification prep and licensure prep within each of our degree programs so that folks can get into industry as quickly as they can. Can you talk a little bit about skills-based employment and what Hiring Our Heroes is doing?
Absolutely. And we take our cues from the workforce at large. So it's not just the cues that we're taking from the military, but we're also taking cues from how our corporate partners are hiring across America. And probably about 3.5 years ago, we really saw the shift where companies and organizations were beginning to embrace skills-based hiring. And so we've worked to create a response for that. Specifically, I think at the March of 2020, Salesforce came to us and launched a partnership with us where we were placing military spouses and transitioning service members into Salesforce roles. So you could very quickly sit through and get certified in your administrator role and then be placed with a partner company, right? And you didn't have to have a degree. And all of a sudden we're like, oh, you can make $93,000 in less than 3 months if you push really hard on this certification. And then we built a partnership with Google, and how do you get those certificates? Most recently, we have we've soft launched our skills-based fellowship as well, and we are able to slot in some of the spouses that are coming through us through MSCAP. And there's layers to that, right? We have to work with hiring managers across America to truly embrace skills-based hiring, to understand what that means when they see an individual's resume. We're specifically interested in learning electronic records and basically being able to create a digital wallet that transfers to the hiring manager so they can very easily internalize what it means to be a college basketball coach and what those skills are that are layered into that, so that we can expedite that process to be embedded with an employer. So we have work still to do across the country, but we know skills-based hiring is unbelievably important, and that goes for any job that you can think of in America. We know that we can put a military spouse into a CDL fellowship, and in 4 weeks, they are going to work driving a truck. And we know that we can put them into construction and into trade. So this allows us to expand the aperture of what hiring looks like for military spouses at large.
Yeah, and to relate that back to the MyCAA scholarship, that MyCAA scholarship will cover at least one professional certification prep and certification, so it's really great. It's
I mean,
it's
I
the
am
way we're going.
a user of the MyCAA when I went to Germany. So
awesome.
It was very helpful.
And if I can just add real quick, you're absolutely right, Liz, because upskilling and reskilling is so incredibly important. Some of the feedback that we're getting about some of the resumes that are sent in from some of our military spouses with our MSEP partners are that they, you know, they want to hire them, but they don't have these skills that they're looking for. And so when we start thinking about what is it that we need, where are the gaps, we have to have those types of conversations. And I think we just recently put in 500 spouses into the Google certification program.
So this is a great segue because we're talking about specific programs and we're talking about funding. So Stan, I want to ask you a question that most people want to hear about funding for entrepreneurs and entrepreneurship through the SBA.
It's a great question. So one of the challenges for all entrepreneurs, comes up constantly as an issue, whether you're a military spouse or a veteran-owned business or anybody who's an entrepreneur, is access to capital is an issue. And so if you're starting a small business, you're probably not going to go to the Capital One or some of those large banks. They just don't deal with those small loans. So I mentioned the Veteran Business Outreach Centers earlier, and we have 28 of those across the country, cover all states, cover all territories in the United States. And they also facilitate all the Boots business classes and teach some of the Pathway to Business courses as well. But one of the things they teach during the Boots Business, Pathway to Business, and the other a reboot class that I talked about is they really focus on getting lender ready, right? So that's a big issue. So many people raise their hand and say, I can't get funding for my business, but in a lot of cases, we're not lender ready. So the Boots Business classes really focus in on how to get prepared to get lender ready, to go look for that access to capital. And it's not just a bank. It could be an angel investor. It could be a CDFI. And so the VBOX, working with those clients, military spouses, veterans, can really work with you on, what is your best bet? Who is lending to the specific industry that you're looking to get into? Now, SBA also offers, you'll hear this term SBA loans. And so that doesn't mean that SBA gives you money. They don't loan the money, they guarantee the loans. So they have a group of lenders that they work with that guarantees those loans. Kind of like if you're buying a house through the VA. The VA doesn't give you the money, the VA guarantees those loans, right? So one of the loans that we have specific to veterans is, gosh, make me think about it now. This is a senior moment, and I won't tell you how old I am, but I will tell you I get these senior moments. SBA Express loans. So the thing with SBA Express loans, which are open to veterans and military spouses, is there is no charge for that loan. So it's zero upcharge for that. And it just, as of 2021, it's now up to $500,000 for that loan. So my advice is, if you're taking these courses or thinking about it, look into the Veterans Business Outreach Centers. They can give you the best bet on how to get that capital for your business, and more importantly, how to get lender ready to be prepared to talk to those lenders about getting those loans.
Awesome, thank you. So we do want to save some time for questions. I know, Patty, we did want to talk just a little bit about how childcare affects employment. So can you talk just a little bit about childcare and some of the opportunities that are there around employment as well?
So you can't separate the two. You can't separate employment from childcare if you have children, especially young children at home, which is the majority of our military children are young. What I can tell you is that, as was said before during the health panel, we have a shortage of childcare providers nationwide. COVID certainly kind of disseminated the childcare business for a while. It's starting to come back up, but not quickly, and certainly within our own childcare program, which is the largest childcare employer-sponsored childcare program in the country. We also see that it's difficult to find folks to come and work in the childcare centers. However, we are doing many things to try to encourage them and try to incentivize them to join us. For instance, we did raise the minimum wage to $15 an hour. I know that other businesses pay more, but that's not a bad thing. We also provide at least a 50% discount if you're a child care provider and you have a child and you're bringing that child to the center with you. You actually get a priority and you can get 50% off of that fee that you pay in the child care center. I want to say the Air Force actually covers that first child completely, 100%. So the services do it just a little bit differently, but everybody has to do the minimum of 50%. We just recently had a child care summit that I'm incredibly proud of. The work that went into that was amazing, and we invited military child care folks from all over the country, different installations and whatnot, and we looked at different topics to discuss. We've piloted some things. We're piloting an in-home child care fee assistance program where the provider actually comes into your home and you receive fee assistance for that, so that we're in our second year of a 5-year pilot. We've also started something called Military Child Care in Your Neighborhood Plus, where we're working with the states to work with their quality rating improvement system. Why is that important? Because before, in order to receive fee assistance, you had to be nationally accredited. Now you can work with your state QRIS, and I want to say we've got 9 states and 1 county, and we've got 3 more states that are going to be coming on board this month. As a result of this, we have opened up more than 3,500 extra spots across the country for childcare. So I don't want to take up time, but what I want you to know is that we recognize absolutely that childcare is an issue that isn't going to go away, because we have young families, and young families, have children. So how do we get after the childcare issue? We're trying very hard to find innovative ways to do this. And the one other thing that I will mention is that, don't poo-poo me, but there are many people that can have entry-level jobs at a child development center as direct care staff, that in the NAF program, the non-appropriated funds program, they actually have amazing career progression. And you might start out as an entry-level staff person taking care of little kids in a room, but I've seen so many times people that have just gone up the promotion trajectory and are GS 13s, 14s, and 15s. Y'all, that's good money. So something to think about. And
many of them on your team right now.
Many on my team right now, and they're incredible.
Yeah, that's true. Thank you. So we do want to get to questions. I do want to give everyone one chance here, and we'll start with Tom. Maybe just like 3 words in your head that you would leave this group with. And I know I put you right on the spot, but 3 words or a sentence that you would leave this group with as far as military spouse employment today.
I would say that it's part of a system. A system is what I would say. And going back to Patty, I always add more than 3 words. It plays into a lot of other aspects of your life. So it's very important in that way.
That's great. So we see someone from a private research or private-public partnership research organization. We see somebody from another federal agency. We see someone from a nonprofit, and we see someone from the Department of Defense. And that, I think, is a really good illustration of the system. So know that there's many, many ways to answer questions, but there is one place you can go for all your answers. It's Military OneSource. So thank you. Thanks, Tom. Stan?
I would say if you're thinking about starting a business and you watch Shark Tank and you say, I could do that, enroll in the classes. And not all the classes are held on military installations or off military installations. We also still have some online classes. In fact, the Pathway to Business will be online and also in person in some places in the country. So if you log on to SBA, Office of Veterans Business Development, or OVBD, it'll take you to the resources, and then there's a calendar that you can click on, and you can pick either a hybrid class, an online class, in-person class, in what area of the country you're at, and see where they're scheduled and sign up for them. And the resources are there. So we've come a long way, And so entrepreneurship is a great opportunity and a great option to employment.
Great. Thanks, Dan. Liz?
Yep. I want to make sure everybody in here knows our definition of a military spouse at Hiring Our Heroes, because we have the ability to do this, is any military spouse that has had their career impacted by a service member's commitment to this country. So we welcome active duty military spouses, veteran spouses, divorced spouses, Gold Star family spouses. We want to be inclusive of military spouses who want to go to work. We will always say, yes, how can we help you? And then the other piece I'll leave you with is that this very much so is a team sport. We make decisions at home based on the good of the family. In our house, we know that I wanted to go to work. I needed to go to work. It was part of my identity and who I was. And so when those marketplaces open, when you're mapping out, should I go to Fort Liberty or should I go to Joint Base Lewis McChord or to Hawaii, right? The choices that you make as a family for the service member's career has a direct impact based on the economic opportunity that exists in those locations. So those conversations have to start at home.
Great. Thank you, Liz. Sure. Patty, last words.
Yeah, I'm going to steal something that the chaplain said yesterday afternoon, a purpose-driven life. That's what we do in the military, those that wear the uniform, those that support the people that wear the uniform. And I am committed. I'm promising you, there are people within the Department of Defense that work incredibly hard to make sure that we provide you with the resources, the tools, and the ability to live a purpose-driven life.
Awesome. Thank you. So I do want to we have about 5 minutes for questions, so I'm kind of going through randomly. So if we don't get to your question, we'll make sure that we get some answers for you. And certainly we have some experts here who may be around for just a little bit outside to talk to. So Patty, what are the new initiatives that might be available to Reserve and National Guard?
That's a great question, and I'm going to point you to Military One Source, and if you go there and put in the search bar, taking care of people, there is actually a fact sheet that's specific to our National Guard and Reserve families so that they know exactly what some of the benefits are that have recently been announced.
Awesome. Thank you. So this one is, I think it says for Meg, but I think it's really Stan. So many military spouses turn to business ownerships and resources, tips, and guidance you can offer them who choose to go this route. And maybe here, I think, Stan, we talked a lot about your resources, but maybe we can talk a little bit about home businesses for military spouses and what's available for them. And I think that might be also a DoD policy, Army.
Yeah, so that's a great question. So that's one of the topics that is in Pathway to Business. We talk specifically about starting a home business. And we also, we're making some inroads with status force agreements, which is always an issue of overseas spouses. So we have somebody that's working on that. And so we're going to do a webinar that focuses on what a status force agreement is, what are the rules of engagement if you're living overseas. But we're definitely in our curriculum about the home-based businesses.
Great, thank you. And the last one, I think we've addressed this, but it does go to what we were talking about. And Patty, I don't know if you have any update, and I know that Department of Labor is also working on some of these, but if Deere's Army says I'm a spouse on my ID card, what is the spouse preference not available to us? The federal OPM, and that's retired spouses. And I'm not sure that's a DoD issue to solve. However, I know you work with them, and Liz, I think just hearing your inclusiveness for the Hiring Our Heroes program is really wonderful. So I think there are already some measures going there.
So one quick thing that I can say is what I think we need to do is bring the Department of Labor, Department of Veterans Affairs, and Department of DoD to sit down and say, okay, so here is the military life cycle. It doesn't end when you leave. Because certainly if you've been serving alongside your service member for 20, 30 years, you've been impacted in some way. And so what else? What are we missing? What more can we do? That I can hope to do.
Wonderful. Yeah, and again, it goes back to that idea of a system. It's not even just one, it's not the two federal agencies up here. I can think of 5 right now that when we do executive orders, how many people come to the table from HHS and all the different, so it really is a whole of government effort, and I applaud you for being able to convene that and bring that together for DoD.
Ask me next year.
Yes, I will for sure. Did we have any other questions from the audience before we end here today? Do we have a microphone? Okay.
I heard you bring up the Google Coursera courses that you had expanded. And I was wondering, kind of like when they do care.com and you can get like a DoD membership. I have 4 kids. My husband's been in 15 years. 7 duty stations in 11 years, I think. So my question is it on the table, is it a possibility that we could do something like the DoD membership for care.com so I don't have to pay for that we could also offer that Coursera membership at a discount? something to think about with our partners as we go, hey, this is a really great, because I've used Coursera, I'm saying I pay for it, and I use it for project management, and that's just a really easy way to get tech, especially in remote locations. If you're not really near a big installation, I'm at Fort Leonard Wood, very remote, when you're talking about career options.
Are you asking specifically in reference to the Google certs?
Yeah,
or
like
separate? So those should, so if you, if any military spouse comes through our fellowship program for the Google certs, those are at no cost to you, and I believe the same through DoD. So you probably were so aggressive and got ahead, I'm assuming, on the PM, but if you went through, anybody that's in the room, if you are going through the Google cert and you are a military spouse, you should be able to come through us, and I know you have a partnership as well with Google. The intent is to have no cost for the military spouse, so I'm sorry that we missed you somehow.
Yeah. I do want to add, too, that we have a program called Udemy, Udemy, and that is a for-free membership, if you will, that provides you with hundreds of courses on many, many different topics, including project management and different things like that. So make sure you check out Udemy and enroll and see what's available to you.
And I do want to do a quick shameless plug. What we've done with the Google certificates is we've actually incorporated them already into our IT and cyber programs at National. And so when folks come to us and they've taken those courses, they actually get college credit and they get course credit for taking those courses, which shortens their degree program and gets them into the industry. So you can see there's a whole lot of work that goes on together with this group. And with that, I want to thank you very, very much for coming here today. Holly and the entire AUSA team, thank you so much for putting this on. Army, thank you very much for giving us the Army Spouse Employment Partnership, so we have it now up at DoD. Yeah, Stan?
I just wanted to point out that I did bring some one-pagers, so I'll put them on the table over there if you're interested in some of our programs, want to learn more about it, so I'll have some one-pagers that I'll set out over there.
Yeah, awesome. Beat Navy, right?
Beat Navy. Sorry, Stan. I just outed Stan. He's a Navy guy. Thank you. Thank you all very much.
You had to do it, didn't you?
We are at an Army event.